Hi everybody, welcome back to another episode of For the Health of It. I am Dr. James Morgan, author of 101 Things Every Person in Healthcare Should Know, and people have questions that they want to know, which is why today our topic is another question and answer, so we'll go ahead and get started. First question comes in from Andrew, and Andrew asks, any hygienic advantages to using wet wipes in combination with toilet paper? And what about those with pre-existing conditions like hemorrhoids or Crohn's disease? Andrew, solid question. I think this is actually a really great question. As far as hygienic advantages, it's really you're keeping your nether regions really clean, right? So anything that deals with cleanliness, you're going to have a good hygienic advantages as to not. So one thing when it comes to using wet wipes, it's think of it almost as a bidet. You're just getting everything nice and clean. Even sometimes a cooling effect there. But sometimes you'll have to take a little bit longer after the wet wipe using just regular toilet paper just to make sure everything's dry, because where does bacteria like to grow? Dark, moist areas. So making sure you're nice and dry down there. So in terms of pre-existing conditions like hemorrhoids or Crohn's disease, this is actually a very, very good question in terms of for hemorrhoids, for example, there's actually medicated wet wipes that you can use in terms of like that preparation H that you can see over the counter. But those medicated pads can help with that cooling effect, but it can also decrease that inflammation that are caused by the hemorrhoids. And for Crohn's disease, just kind of keeping it a nice, soothing effect as well. So Andrew, great question. The second question comes in from Chelsea, and Chelsea asks, what is your approach or thoughts about patients that come in saying, well, I found this on Google and this is why I'm here? Chelsea, I like to call these people my self-diagnosing patients or our internet medical providers. My approach to these is one, I want to hear you out. Here's the thing, I'm not telling you to not look these things up, but also just to take it with a grain of salt in that terms, because you can look up your symptoms, runny nose, cough, things like that, and then, hey, I have West Nile virus and that's why I'm coming in. Or, hey, I have a cough at night and I had a little bit of blood come up. Now I have tuberculosis. So, usually we all tend to want to go to the worst case scenario. That's our job. Let us be able to rule everything out. If you have symptoms that you can't control on your own, then definitely come in to be seen. Try your best, if it's especially the common cold, things like that. What we're going to tell you is to do it symptomatic care anyway. But my thoughts on it are just that. It's the internet. There's a lot of things you can find on there. There's a lot of great information on there, but also if you add that great information to a potentially anxious mind, you're going to come in with higher expectations, and you're going to be more upset when we tell you, hey, it's just a common cold. Make sure you wash your hands, drink more water, and get some rest. But it's important, though, to listen to your body. That's more important than looking things up online. If you're not feeling well, maybe something that you're not used to, you have a symptom that hasn't been around before, listen to your body. Your body's going to tell you when things are starting to break down. So, Chelsea, great question. And then final question comes from James. James, strong name there, my friend. And this is a great question. Why does your pee smell after eating asparagus? Well, something like asparagus has a sulfur-containing compound called methyl mercaptan, and another compound, asparagine. And that's as the asparagus goes through your system, it's broken down through your digestive tract and then filtrated out. And those compounds release that all too familiar smell of asparagus as you urinate. So, James, I'm glad you're eating your asparagus. Asparagus is a great green to have in your diet, a lot of nutrients there. But hope that answers your question. If you have any questions, make sure you reach out to me. You can find my contact information on the website, www.americanmedicaleducationcenter.com/contact, if you want to go right there. If you're interested also in getting my contact information along with a introductory newsletter, text the word Dr. James to 44222 and I will send that over to you right away. So if you have any questions, again, reach out. Thanks so much for tuning in. This is another episode of For the Health of It. I'm Dr. James Morgan. I'll see you next time.